Good morning, happy Friday, and welcome to another episode of Sick Call. This week we have Major Derek Baldwin with us. Major Baldwin is a family medicine physician in the U.S. Army on active duty. Welcome, sir, and we're excited to have you with us this week.
Thank you. Excited to be here.
And we also have with us Staff Sergeant Travis Burleson. Staff Sergeant Burleson is a member of our physician recruiting team. Good morning, Sergeant Burleson, and welcome.
Good morning. Thanks for having me.
And of course, we have our team here at the Valencia Medical Recruiting Station, Major Elrico Fernandez.
Hello, everyone.
Sergeant First Class Michelle Phillips.
Hi, good morning.
Staff Sergeant Scott McMenemy.
Good morning.
And myself, Sergeant First Class Michael Cube.
Well, good morning, Major Baldwin. Can you please start off by telling us a little bit about yourself?
Sure. I'm a active duty Army family medicine physician. I've been in the Army for approximately 22 years total. Started out in the 90s as a enlisted infantryman. Did that for a few years, transitioned over to do satellite communications for another 6 years or so. Then got out, pursued my bachelor's degree, utilized the HPSP scholarship to go to medical school at the Medical College of Georgia. After medical school, I did my residency at Fort Gordon, Georgia in family medicine. Was a chief resident there, and then moved on to Hawaii, where I actually met Major Fernandez. We worked together in the 225 DSB as the Role 2 medical team there. For a few years, and then after leaving Hawaii, I moved to the DC area, where I'm now at Joint Base Meyer Henderson Hall, working as the Chief of Executive Medicine at Fort McNair, and splitting my time between doing that and as just a staff family medicine physician in the clinic.
That's cool, sir. What were your summer rotations like for you during medical school?
They were great. I did one rotation at Fort Gordon as a active duty rotation. Also did several rotations there as a civilian rotation because my school was pretty close by. I rotated at Fort Bragg at Womack Hospital. That was a pretty good rotation as well. And then for my final rotation, I got a nice free paid vacation to Hawaii for a month. To go rotate out at Tripler and interview there.
Sir, what types of settings have you practiced in?
So I practiced in a residency program setting, in a operational unit setting, in a executive medicine setting, which is basically kind of like regular clinic, with a focus on taking care of higher ranking individuals, so general officers and their families. Some of the senior colonels actually take care of all the people at like the National War College and Eisenhower School and all the other senior military schools up at Fort McNair. And then just a general full spectrum family practice clinic. And then also doing operational medicine while deployed to Afghanistan.
So you mentioned that deployment, Doc. Can you just break that down to the viewers? What is a med corps, a physician in the Army? What is that like in your last deployment?
Sure. So there's actually a couple different ways that you can be deployed as a physician. So you can deploy as part of a CASH, a combat hospital. And in that role, your kind of main job is just being a doctor at one of the hospitals. So usually a Role 3 medical facility. Which is kind of like the equivalent of a civilian trauma center out in the battlefield. The other way that you can deploy is part of a force comm unit, which is what I did as a battalion or a brigade surgeon. So with those, you actually go out with your infantry or engineer or whatever unit as their primary physician. So you can either be out in a remote location by yourself with a couple medics, sometimes with a forward surgical team co-located or nearby, or in other cases like I was, you can be at one of the bigger bases, and then you can treat your patients in your unit out of your battalion aid station, and or work at the Role 3 medical facility, which is what I did. I kind of split my time between the two.
So, sir, what's something unique about practicing in a field environment other than being outside?
It has it's a lot of pluses, and it's really challenging. So if you're in for a challenge, it's a really good way to get a challenge. But it does make you learn how to use all of the things that you have to their fullest, and sometimes learn how to use things for purposes other than the ones that they were originally intended for to make them work well. One of the great things about it is you get to see the fruits of your labor pretty readily out there. So rather than normal medicine where we're doing things that are affecting people's lifespan 10, 20, 30 years from now, the things you do out there, you get to see immediate results. So a perfect example is we had a soldier who got shot, lost vast majority of his blood. The forward surgical team stabilized him, transferred him over to our facility. I activated the walking blood bank. We collected 200 plus units of blood and transfused over 160 of those units into that soldier and saved his life. So it's something like that you never would get to see, in a regular practice.
So then what would your normal day in a clinic be like, sir?
That really depends on what sort of clinic setting you're in. So if you're in a typical MedCom primary care clinic, your day usually consists of just seeing a wide variety of patients. So I see everything from newborns to, I think my oldest patient right now is 101. And so that and everything in between is what our day consists of. So it keeps it interesting. It's the reason I chose family practice. I like a wide variety. I don't like doing the same thing day in and day out. And so this keeps me on my toes.
So I think you already answered this, but what's your favorite thing about being an Army physician, specifically Army?
So the best thing about being an Army physician is the ability to do full spectrum primary care, at least from a primary care standpoint. In a lot of the civilian practices, they are limited by how economically feasible certain things are. So they don't do obstetrical care because it costs more for the insurance than you make seeing the patients. They don't do other things because they would lose money in their practice if they do those things. But in the military setting, our focus isn't on making money, it's on taking care of our patients. And so I actually get to do pretty much everything that I'm qualified to do.
That's nice, sir. So what are some of the unique positions that a physician can expect or look forward to holding in the Army?
So there are things like I was talking about with the executive medicine. So that's pretty unique to our setting. I mean, there are places that call themselves executive medicine in the civilian world, but it's not quite the same thing. You're not taking care of, just high level individuals like you do in an executive medicine setting. White House physician. So that's something that's available where you basically go and take care of the first family, the second family, and the president, vice president, and the senior cabinet members. There's opportunities to do operational medicine and a battalion and brigade surgeon level, division surgeons, brigade or corps surgeon and up. There are a variety of different primary care settings available, some that are full spectrum, some that are limited. You have residency program settings where you can actually go and be staff training new physicians. There are community clinics where they basically are small satellite facilities set up in the local communities that are ran by the Department of Defense. Work as a primary care doctor. I could work in an ER setting if that's something I was interested in. Flight surgeon is another possibility.
So there's definitely a lot of different unique opportunities that physicians can take advantage of in the Army, like jumping out of airplanes and helicopters and doing all those great things too. Those are great gee whiz things that you're not going to find in a normal hospital, if you will, quote unquote normal hospital. And this morning we have Sergeant Burleson with us with the physician recruiting team because his team heads up the physician recruitment for our company. So I'm going to kind of let Sergeant Burleson take a couple minutes to kind of tell everybody what maybe to expect if they're a physician currently practicing and are interested in the Army.
Yes, of course. We are actively seeking board-certified physicians of all specialties to join the Army. Our team is happy to answer any questions about requirements and current incentives, such as our health profession loan repayment program that's up to $250,000, for example. We're always looking for highly skilled physicians, like Major Baldwin here, to join the Army and provide world-class care to our soldiers in either full-time or part-time capacities. Please feel free to contact us at the information provided on the screen or in the comment sections below, and the Valencia team will get you in contact with us. Thank you.
And of course, we're always looking for, HPSB scholarship recipients for medical school. Take advantage of those great opportunities like Major Baldwin did, because someday you could be him. Not him personally, but you know what I meant. So with that said, hey, sir, can you give maybe our viewers that might be considering medicine in the Army for themselves a piece of advice or something you wish you would have received prior to coming in as an Army medicine officer?
Yes. So the biggest piece of advice that I give to all people that I know who are prospective medical students is make sure that you are doing this for the right reason. So what I tell people frequently is there are a lot of jobs that are prestigious and pay really well that are nowhere near as challenging as being a physician. But if it's something that you really want to do and it's something that you want to do for the right reasons, then the challenge is well worth it. And so go forth and do it. And particularly with the military, not having to worry about student loans, not having to worry about malpractice, the things I talked about earlier about being able to do everything that our specialty is capable of doing are all amazing reasons to do it through the military.
Nice. Thank you, sir, for taking your time out of your busy schedule this morning.
No problem. Happy to be here.
And thank you to Staff Sergeant Burleson for joining us as well.
My pleasure. Thanks for the invite.
And this will wrap up another episode. Thank you to our viewers for tuning in with us live. As always, we welcome your questions. Next week, we will have Lieutenant Colonel Janice Daniel on the show. Lieutenant Colonel Daniel is a U.S. Army certified registered nurse anesthetist, and she's going to talk to us about the Army CRNA program. As always, we welcome your feedback, and you can comment below or on any of our other social media platforms. We hope everyone has a happy, healthy, and safe weekend, and we look forward to seeing you again next Friday at 10 a.m. here on Sick Call.
Bye.